Good afternoon. I'm Megan Ressler, working in the Cancer Education Center at Mayo Clinic in Rochester, Minnesota. Our webinar topic today is Understanding Your Blood Counts, and two colleagues of mine, Terra Register and Gina Lange, are going to be leading us through this session today. So we want you to know that it's being recorded so that people can watch after the fact if they weren't able to join us during the live session right now. We will have time at the end for question and answer. So if you have questions, you can certainly type them into the chat and we will address questions at the end of it. I will also be sharing a few different links to some information for you. So you could, if you watch the chat for that, you'll find the links. And one of them that I'll put up in just a moment will be for Mayo Clinic Connect, where we continue to advertise future webinars that we have. And that's also the place that you'll find the recorded ones that we've already had in the past. So with that, I'm going to go ahead and turn it over to Gina and Terra to start us off.
All right. Thank you so much, Megan, for the warm welcome. So for this webinar, it's Understanding Your Blood Counts. So I myself, Terra Register, and Gina, we would like to thank you for joining us during this presentation today. I am a registered nurse and I work here in the Cancer Education Center here at Mayo Clinic. I have been with the center for the past few months, previously working in the field of cancer research and clinical trials. And amongst that, some other various roles within Mayo Clinic. I will let Gina introduce herself at this time.
Hi, my name is Gina Lange, and I'm also a registered nurse here at the Cancer Education Center. I've been a nurse here at Mayo for the last 8 years, primarily in hematology. Most recently, I was a care coordinator with the CAR-T program until a couple months ago when I joined the cancer education team with Terra.
All right, thank you, Gina. So we will continue with our presentation on understanding blood counts during cancer treatment. All right, so this webinar is geared towards helping patients and families understand their blood counts. So we will help you identify the role of why they are important to monitor while getting care for cancer. This includes which counts that you can keep track of while not getting too much into depth, what you can do to monitor, as well as some of the terminology that you may hear from your healthcare teams. We will also talk a little bit about some of the steps you can do for management of at home and when they are not at their expected range. This will also include some of the signs and symptoms that may be reported, should be reported to your healthcare team. So first of all, we have a short video that we're going to share with you to kind of explain, that has a very good explanation and a really good summary of the blood cells in your body and the roles and some of the key things to keep in mind while you're at home. So just bear with me just a moment while I get this opened up for us today. All right, can you see the video, Gina?
Yes.
All right, perfect. Here we go.
Blood counts are a measure of the amount of blood cells in your body. Chemotherapy and radiation treatments work to kill cancer cells, but these therapies can also affect healthy cells in your body, including blood cells. Immunotherapy, another type of cancer treatment, but different from chemotherapy and radiation, boosts your immune system to allow your body to fight the cancer. Your healthcare provider will tell you which kind of cancer treatment you receive and how it may affect your blood counts. Blood cells are made in the bone marrow, which is located in the center of most bones. Some cancer treatments prevent your bone marrow from making healthy blood cells. When your body doesn't have enough blood cells, you have a low blood count. Many people experience low blood counts during their cancer treatment, which can affect all three types of blood cells found in your blood. White blood cells detect and fight infections. There are several types of white blood cells, including neutrophils, lymphocytes, monocytes, eosinophils, and basophils. During cancer treatment, your healthcare team will carefully watch your neutrophil cells, which are the most important white blood cell for fighting infection. Some cancer medications cause your white cell level to be low. If this happens, your healthcare provider may prescribe an injection or shot to help raise your white blood count. A low white blood cell count means your body may have trouble fighting an infection. One of the first signs of infection is a fever. You should never ignore a fever. And do not take medications that reduce fever without first talking with your doctor or nurse. And call your cancer care team immediately if you have a temperature of 100.4 degrees or higher. There are a number of things you can do to help prevent infection. You should wash your hands often with soap and water. Use hand sanitizer and sanitizing wipes to clean surfaces and items that you touch. Be gentle and thorough and wipe yourself from front to back after a bowel movement. Stay away from people who are sick. Maintain good mouth and skin care. And follow safe food handling and selection. Red blood cells deliver oxygen to your body. The amount of red blood cells are identified by your hemoglobin and hematocrit levels. Hemoglobin is a protein in the red blood cells that carries oxygen. Hematocrit is a measure of the percentage of the volume of whole blood that is made up of red blood cells. If your red blood cells are low, your body is not getting enough oxygen. This condition is called anemia. Symptoms of anemia include feeling tired or short of breath, dizziness, and feeling like your heart is racing. Tell your healthcare team immediately if you have these symptoms. To help manage symptoms of anemia, be sure to get enough rest, eat a diet high in protein, and change positions slowly so you don't fall. Also, physical activity is often the best treatment to help manage fatigue, so try to stay active and keep moving during your cancer treatments. Take a walk or exercise on days you're feeling well. Platelets are blood cells that help your blood to clot. If your platelet count is low, you may bruise or bleed more easily. You may have small red spots on the skin, usually on your legs or skin that are signs of bleeding. To prevent bleeding, if your platelet count is low, be careful around heavy machinery and using sharp tools, including self-care items like razors and fingernail clippers. Also, blow your nose gently and brush your teeth lightly with a soft toothbrush. And drink plenty of fluids to avoid constipation. To raise your platelet level, a blood transfusion may be used to add platelets to your blood. Your cancer care team monitors your blood counts carefully. They'll help you manage any symptoms or conditions caused by low blood counts. If you have any questions about blood counts or cancer treatment, talk with your care team.
All right. So it's a great video. Just really use quite a bit of useful information when we consider labs or blood counts. When we're, when we are going to expand a little bit more on considering counts while going through treatment. So why do your blood counts matter? Oh, excuse me, something's going on with my computer here. Healthy cells are constantly growing and regenerating. Some of them are responsible for example, like fighting infections, clotting the blood after an injury, or even moving oxygen from the lungs to other important tissues and organs for repair. So when the blood counts are altered, oh my goodness, something happened there. I'm sorry about that. My computer is not cooperating with me today. All right. There we go. All right. So when the blood counts are altered, they can, sometimes these can, very few examples of how your body can heal. All right. So what happens to these normal healthy cells during treatment? So the purpose is to kill off those cancerous cells, but healthy cells can also be affected as well. The effects do not happen immediately. It usually takes a few days. The drop may be significant or slight. It does take time for those cells to regenerate. So What other factors determine these guidelines? Well, your treatment regimen, including your type of treatment you're receiving, can alter those blood counts. And then also just some of the, depending on the person or the dosing that person is receiving, they're all different. So, some of these things would be some really good questions to talk with your treatment teams about. Nurses on your care team can help prepare you on what to expect with your treatment team. So what's in the counts? So there are many different types of tests that can be performed, but to be more focal in this area, we look mainly at these listed here on the slide. The typical lab that is drawn is the CBC, which is broken down parts that they look at. So white blood cells, and then also there's the neutrophils, hemoglobin, and platelets. So the white blood cells, or what they call WBCs, are produced in the blood marrow and aid in fighting infection, but also can indicate if your body is fighting an infection. The neutrophils, which is that subtype of the white blood cells, they are most important for fighting infection. Neutrophils are sometimes referred to as an ANC, which is an absolute neutrophil count. Okay, the hemoglobin, or HGB, these are parts of the red blood cells that transport oxygen to other tissues. And then the platelets, responsible for clotting the blood when cut or injured. As stated on the slide here in yellow, your treatment team will be watching these numbers very closely and will notify you of concerning numbers, and if any interventions are needed, including extra precautions or medications to help raise those levels. Your provider will order labs desired and according to your individual plan for care or treatment plan. So typically before your treatment, but may vary, your care team will be the appropriate source to find out your individual schedule. So what can you do when it comes to monitoring your counts, or how can you help? Did you know that if you are a patient through the Mayo Clinic, you or any of the other associated sites, the patient portal can help you view your blood test results. So if you don't have the patient online services account, we will put a link in the chat for you to get signed up. You will need to know your medical record number, or you can simply call an operator to help get that information. As stated before, your healthcare team is closely monitoring those numbers with all the specific tests that involve your treatment plan and your diagnosis. You can take part in keeping a journal at home for yourself, or record keeping. Why? Well, if your levels are out of range, then you can track what kind of symptoms you observe during these times and report them to your physician. You are the essential part of this treatment course. If you notice anything that may be worrisome, report to your healthcare team. So we would like to review some of the common terminology that you may often hear while in the doctor's office or in the infusion department. So neutropenia or neutropenic, the CBC, anemia, anemic, and thrombocytopenia. So CBC is that short-term word for a complete blood count, which is that lab. This includes red blood cells, platelets, that white blood cells, and neutrophils. So neutropenia or neutropenic, meaning your neutrophils or your ANC is below the normal level range. Anemia or anemic, meaning your red blood cell count is low. And then also thrombocytopenia, where your platelets, those levels drop below the desirable range, okay? If your numbers are below those ranges or those low levels, the provider may hold or delay your treatment for a few days to let your body recover. This is specific to your treatment and your provider. So just really communicating with those healthcare teams is very essential. Next, Gina will be providing you some more information on when those levels are low. For example, some symptoms that may or may not occur, as well as some precautions to take at home.
Okay, thanks, Tara. So to start, I'm going to talk about some precautions to take at home if your white blood cell count, hemoglobin, or platelets, as she mentioned, are low. So first, we'll discuss the white blood cell count. So as mentioned previously, neutrophils are a type of white blood cell that help fight infection. So when they are low, the condition is called neutropenia. So some suggestions or recommendations that you can do for yourself are to avoid large crowds or those that might be sick. And this is especially true during our current pandemic. Also, make hand washing and good personal hygiene a habit. So, there are numerous research studies out there that have shown that 30 seconds of simple hand washing with soap and water can reduce the bacterial count on your hands by almost 60%. If you use alcohol based hand rubs, this reduces bacterial counts to around 80%. So, really important that just, simple hand washing is a great way to help with infection. Also, wearing a high filtration mask whenever out in public is a good practice. So some reasons you may want to contact your care team would be the following. So if you develop a fever of 100.4 degrees Fahrenheit or 38 degrees Celsius, you would want to either contact your care team or you may be directed to go to the emergency room for an infection workup. So your care team will discuss that with you and tell you what they recommend prior to receiving your treatment. If you develop a cough, sore throat, mouth sores, or white patches in your mouth, those are reasons that we would want you to contact your care team. Sometimes if you develop white patches, they may be related to a condition called thrush, which is a treatment or which we have a treatment available to help with that. Changes in elimination. So for example, if you develop diarrhea or constipation over the course of 2 to 3 days, or if you experience any increase in burning pain or frequency with urination, those are definitely things that the care team would want to be notified about. If you notice any new rash, swelling, or redness on your body. And lastly, if you experience any new, persistent, or unexplained pain, we would want you to contact the care team for further direction. Next, we'll discuss what to do when you have a low hemoglobin. So as Tara mentioned previously, the hemoglobin is part of the red blood cells that is responsible for transporting oxygen to tissues. So some guidelines or suggestions to keep in mind would be the following. So get enough sleep. Give your body periods of rest with short naps, as your body may tire easily when going through treatment. And then also subsequent treatments, you may notice that you're becoming a little bit more fatigued. So it's really important to try to listen to your body and get rest when you need it. Another is to reserve energy. So take rest periods for your body to recover. Another thing that we've recommended is to prioritize those most important activities to be done first. Also, you can ask, help. I know we here in the Midwest especially don't like to ask for help, but it's really important just asking help from friends or family in completing tasks when you're tired, just because going through this can be exhausting and your body may tire more easily than it did in the past. Avoiding injury. So exercise is important in small increments. However, pay attention to your body. If you do notice any shortness of breath or dizziness, then you should stop the activity, as this will help preventing an injury or fall. And then a balanced diet, eating foods high in iron, such as green leafy vegetables. However, we do recommend that you ask your care team if this is appropriate, just because there's so many different nutrition guidelines out there right now. So just really have that conversation with your care team. Also, drink plenty of fluids. That's really important while going through therapy, and you'll hear that over and over again to push fluids while getting treatment. And then if you do wish to take supplements while receiving your chemotherapy, we recommend speaking with the care team pharmacist just to make sure that there's no contraindications with your specific plan. And then a reminder just to contact your care team if you develop any dizziness, shortness of breath, or difficulty getting from point A to point B, excessive weakness or fatigue, and or if you develop any chest pain or feel like your heart is racing, as these may all be indications for a low hemoglobin. And then lastly, we're going to discuss what to do when your platelets may be low, as the platelets are what help clot your blood. So when they do become low, you may be more at risk for bleeding. So first, it's important to have good oral care. Use a soft toothbrush in gentle circular motion when brushing your teeth. Also, keep your mouth clean and moist. It's not typically recommended to use dental floss or mouthwashes with alcohol in them while you are receiving treatment. Second, when walking, try to wear shoes or slippers to help protect your feet. Avoid strenuous activity or heavy lifting. And you may also want to avoid any activities that result in falling or injuring yourself, such as bicycling, rollerblading, or ice skating, to name a few, as we had kind of mentioned previously as well. And then again, just, keeping that mouth hydrated, drinking plenty of fluids will help keep those mucous membranes moist, as well as help prevent constipation, which can occur with some of the medications that you're taking, or maybe could potentially be taking. So if you do develop any bleeding that lasts for greater than 10 minutes with pressure applied, or if you experience any blood in your urine or stool, or have any changes in your vision or persistent headache, you'll want to seek medical attention, as these could all be indications of a low platelet count. And that's all that I have.
All right. So this kind of concludes our slide presentation. We'll leave any of this time for any questions that you may have. As always, we want to remind you that communication with your treatment team is very important. And if you have any concerns, to please direct those questions specifically to them.
So if people have any questions, if you could type those into the Q&A or into the chat. While Terra and Gina were presenting, I did put some different links into the chat for people. So hopefully you can grab those. I will also post those links on Mayo Clinic Connect, along with the post that we had advertising this session for you today. So I'll just wait and see if people have any questions that come in. I will remind people to like and follow our cancer education blog on Mayo Clinic Connect to find out about further webinar offerings that we'll have, and then also to access the recording for this session today.
And I'd like to just add to Megan, the links that she put in there are really great resources. So, we mentioned a few things over and over again, the neutropenia, kind of what to do at home when those blood counts are low. There's some really good literature in those links that can kind of navigate and help you just, take those precautions.
So we have one question that came in that said, for those following a low sodium, low roughage diet, are there nutritional resources?
So for that question, I would probably specifically reach out to the care team to see if they have a dietitian that can, take a look at your exact chemotherapy regimen that you're receiving, and let you know if there is a ton of nutritional resources out there. But I would really suggest to zero in on your specific treatment, and then also look at those nutritional recommendations.
Yes,
I don't know.
Okay. I also agree with Gina on that. Is, depending on what medications you may be taking and the roughage, a dietitian would probably offer you the best resource.
Someone asked, typed a question that asked where you'll find the links. So I put the links in the chat. So hopefully you're seeing the chat. There's links for changes in your blood counts, neutropenia, and then I'll also post those links on Mayo Clinic Connect. Okay, This person says, my husband has been told that he has G6PD, slightly anemic, and not to eat certain legumes. Why is that? I don't know if either of you know the answer to that or not. I'm not sure.
Yeah, I unfortunately do not know why that would be. But there probably is a specific reason, and that's why it is really important to get a dietitian on board. Just to there's so much research, as I mentioned before, with nutrition. It's kind of the hot topic recently. So I think more and more literature is coming out on what to eat, what not to eat. So we have to realize that some of that is broadly given. And so that's where I think specifically it's important to talk to your dietitian and have them look at your specific treatment plan so they can tell you what's right for you, not what's right for a friend or so on and so forth, just because there is so many differences out there. But unfortunately, I don't know. I don't know if anybody else has an answer or has more insight to that one, but
Oh, I think that was perfectly explained, Gina. I couldn't agree more. I do see another question here. My white blood count is normally low. Are there any extra concerns I need to be aware of? Really depending, your counts could be a normal low, as they would call it. A lot of people do run lower or higher. They really look at the trends on how your blood counts kind of go through. So it could be just at a normal range. If that's the case, I mean, it's really a symptomatic type of thing. So if you're displaying any of the symptoms, then I would specifically trust that, you keep track of that and that you let your care provider know if, you're displaying any of those.
Do you know if people are dehydrated? Sometimes I think that could alter how your blood count. I don't know. Do you know anything about how hydration or dehydration could affect our blood counts? Maybe you do, maybe you don't. I'm just a question. Oh, that's all right.
So Janine, so does dehydration affect blood counts?
Yeah, are not necessarily blood counts, but how they look or how they come back. Because it seems like if a person is really dehydrated, sometimes you can have a misleading of what the counts actually truly are because of. Is there something to that? I feel like I've heard that, and I'm sorry if I'm putting you on the spot.
No, I mean, I think that's more, I know specifically in relation to like kidney function tests and things of that sort can be altered if you're dehydrated. And, there may be some effect with, some of the white blood cell counts, things of that, but I don't feel like it
wouldn't really affect.
I think it would more affect the hemoglobin, actually, to be more specific with, how the cells kind of inflate and kind of swell up or dehydrate. So the ability for them to affect and take in oxygen. So a lot of those things are a huge contribution.
Okay, thank you.